And now it is my great, great, great pleasure to introduce to you my colleague, but also especially my friend, Professor Francisca Oladipo from the University of Lokoja in Nigeria. And she is the executive director of the Virus Outbreak Data Network Africa. And all of the things that have been mentioned here until now, that data are so key to how we are developing health systems into the future. What went wrong in how we addressed this pandemic, and how we have such an incredible win-win to make between Europe and Africa as scientists, as health practitioners, as data intelligence community. She has been able to capture, she has such an incredible network wherever across Africa. You need a computer scientist, a IT expert, a data scientist. You find Professor Francisca, and she will lead you to somebody with excellence. So it's a great pleasure. I know, like for all of the speakers, you had to empty your agenda even as you're preparing your inaugural address. Professor Francisca, it's a great honor to have you here, and the floor is yours. We look forward to your presentation.
Thank you very much, Professor Van Rijsen, and for that beautiful introduction and for coordinating this event on our behalf for the Africa and the EU collaboration. I would like to respectfully take the protocol that has been established, but then recognize the presence of the #1 African citizen, Your Excellency, Fortune Charumbira, and of course our keynote speaker, Dr. Fransen, who demonstrated so much knowledge about Africa. And of course, that is to be expected. Africa and Europe, they have had this long history of collaboration. So I would like to acknowledge the previous speakers as well. Clara, if you'd like to advance the slide. So I'm going to be speaking on our projects, the Virus Outbreak Data Africa Network. And sometimes we are called VODAN Africa, sometimes VODAN Africa and Asia. We have VODAN Africa as the Africa-based legal organization, and then the implementation arm, which involves cooperations with our partners in Europe, in Asia, in Australia, and including China, is the VODAN Africa and Asia. Late in 2019, there was the news of the outbreak of coronavirus somewhere in China. Many of us in Africa, we never even heard of the town Wuhan. And to us, it was just a Chinese thing. And it started moving all over the world, and we felt, oh, well, Africa has nothing to do with us. And by March of 2020, all hell was let loose. There was disruption everywhere. Schools were closed, borders were closed, airports were closed. It was a general situation of hopelessness all over the world. But for us in Africa, the situation gave us hope, gave us opportunities, and we learned new things. We formed new partnerships, and we received more support from our European partners. And so in March 2020, with a seed grant from the Philips Foundation based in Europe, a group of scientists, researchers, medical practitioners, and then ministries of health, universities in Uganda, Ethiopia, Kenya, Zimbabwe, Nigeria, and Tunisia, we came together. And with the support of our friends in Leiden University Medical Center, and Tilburg University, we formed the VODAN Africa Partnership. The focus was, the entire world was focusing on getting vaccines, getting treatments, and then there was the communication sciences trying to inform people, trying to dispel misinformation. And then we looked at it. There is also the social sciences that provide counseling. A lot of people were affected by the COVID-19, and they were providing support all over the world. What can Africa bring to the table? How can we support these different kinds of science that were fighting the COVID-19? The science of medicine is important, The science of communication is important. The science of sociology is important. Even economic science is important. Then we went into the science of data to ensure that all the frontliners from Africa especially and the rest of the world, they have access to data that has provenance, data that is official. They're able to find the data, they can access the data is interoperable across several platforms, and the data can be reusable. How do we ensure this? How do we ensure that Africa has a place in the fight against the COVID-19? Then the child of necessity, VODAN Africa, was born. And so in the context of COVID-19, VODAN Africa provided the first successful implementation of data in residence, such that in October of 2020, we were able to demonstrate data visiting, so that the data collected in Uganda resides in Uganda under the authority of the government of Uganda, obeying the privacy and data protection law in Uganda. The same applies to Ethiopia, to Kenya, to Zimbabwe, to Nigeria, and Tunisia. And then computer algorithms from the Leiden University Medical Center was able to find this data in residence, interact with this data, do analytics with this data while the data remains unchanged, so that the next time another computer algorithm or any human researcher from China needs to use data from Africa, it will find the data in residence in Africa under the ownership and governance of the country in Africa. It will be able to access it because there are clear accessibility conditions provided. And then across several platforms, whether it is different operating systems, different data storage environments, and because data remains unchanged and authentic, it can be reused several times over time. And we're able to install 9 of the COVID-19 fair data points in Africa with the funding support of Philips Foundation, and 1 in Leiden University Medical Center. And of course, in addition to the installation of the fair data point, we were able to do capacity training. A lot of people in Africa didn't know about FAIR. A lot of people in Africa didn't know about GDPR, and there were no movements. So over the internet, every week we meet, we have technical meetings, and we do training on metadata for machines, on FAIR implementation, on creating vocabulary, on creating templates, and a wide range of technical aspects of data science and artificial intelligence with special focus on healthcare data. Moving on from the installation of the FAIR data points, we identified some gaps in Africa. Because the FAIR data points were implemented using the WHO electronic case reporting form, we saw the need to strengthen health informatics in Africa, that researchers at the point of care can have access to the data collected and be able to do analytics. And we needed to find a tool that can be customized for the African. And we had to do another reverse linkage. We turned far up to the west to the United States. And then we approached Stanford, and Stanford University graciously allowed African researchers to rebuild the CIDR verification tool to suit the circumstances of African healthcare system. And now we're implementing in 84 health facilities across different countries in Africa. And beyond the original 9 locations, now we have expanded to Tanzania, to Liberia, to Somalia, to Burkina Faso, and we're presently looking into Sudan and South Sudan to ensure that every country in Africa is no longer listed as the rest of the world, where researchers are presenting the sources of their data production. You see things like, Switzerland, from Poland, from United States, and then from the rest of the world. We want every country in Africa to be named as the source of this data is from the IBBUL Health Facility in Nigeria. The source of this data is from the Federal University Medical Center in Nigeria. The source of this data is from the KIU Teaching Hospital in Uganda. That is what VODAN Africa has been able to do. And we didn't just do this to keep this knowledge to ourselves. We're also publishing it and making it available. One of our key publications, we're going to hopefully, Clara, you'll be able to show the video later on before the end of my presentation. And of course, we have a total of 23 articles, Professor Miriam, with the data intelligence in collaboration with the Chinese Academy of Sciences. And this will be published by the MIT Press in Boston. Reverse linkages as well. We in Africa, we have enjoyed so much support from the EU and from other partners in the West. If you'd like to advance further, Clara, to the next slide. And therefore, what are the critical issues? What have we learned from these experiences? That there is the need for the regulatory framework for data production and management. There is, of course, the FAIR principle, which supports the findability, accessibility, interoperability, and reusability of data. And there's a GDPR for Europe. In addition to this, for us in Africa, we respect the privacy and data protection laws of each African country. In fact, we have cases in Nigeria where out of the 20 health facilities, we have about 7 different laws, and each law has to be respected. So this ensures that researchers have access to data that are official. They have provenance because they respect the laws of the country. They have the stamp of ownership of that country, of that health facility, of that point of production. And this also helps because data is no longer going to be warehoused elsewhere. They're not going to be removed from Africa and kept elsewhere. We learned a lesson from the Ebola crisis. We really couldn't find access to those data any longer. But it is not the same with COVID-19 in Africa, because we have ensured that we have COVID-19 fair data points. And even if in case of any mishap, the data points cannot be found, the metadata is available, and it will lead the researcher to the actual source of the data. Africa has been at the forefront of designing the first distributed machine actionable interoperable data system. We had demonstrated this earlier as a proof of concept in October of 2020, and we are demonstrating this now in 84 health facilities and counting. We actually got to a point and had to like, okay, let us finish up with this 84. And one beautiful thing about this is an African knowledge, indigenous knowledge system. It is owned by Africa. The technical implementation, the hospital implementation, it is done by African researchers and scientists with support from our partners in the EU. We have funding from the FMO, which is the Dutch Development Bank. We have funding from NUFIC. We have funding from CODAID. We have funding from Philips Foundation. These are EU-based organizations, and then they are providing this support. And we also get some technical support from researchers from LUMC, from Leiden University.
Just waiting for the link to restore. Just waiting for the link to come back. That is what happens online. Dr. Ibrahim, is your link working?
Yes, Prof. I think.
Why don't you finalize?
Okay.
Dr. Ibrahim is the right and left hand of Professor Francisca. Professor Francisca is back.
Okay, yeah.
Okay. Yes, thank you very much. And if you go to the next slide, Clara, thank you. And therefore, I want to briefly show this history of cooperation of data visiting across Africa and Europe. As you can see in the diagram, we have the fair data points in different African countries, and then we have the fair data point of CEDA in North America, and then you have the LUMC fair data points. Yes. You can see how the cooperation occurs over different technical framework where we can exchange, not exchange data because we're not moving data, but algorithms can move across these countries and then utilize the data, perform analytics. So locally analytics, and then intercontinental analytics, And then intra-continental analytics in Africa. We are cooperating with researchers in LUMC for the Andrea platform. So much for and of course, in Africa, we're also building our own dashboard. We have built an embedded collaboration into SIDA that allows for those old data that have been collected in paper form, in bulk form, they can now be digitized and exported in bulk into the fair data point without anyone having to sit down to manually key them in. Finally, before I play the video, Clara, if you go to the concluding slide, Africa has started a revolution. We're building a new internet. And we already demonstrated in VODAN Africa that Africa and Europe can work together to advance these new internet ideas where data ownership remains in place at the point of collection. And then the data is not only globally available, but within the local environment at the point of collection, researchers can do analytics themselves. They can actually see trends. And we also permit data visiting, where computers, machines, humans can actually visit the data in residence through the principle of FAIR. Thank you very much, Clara. If you can just play the VODAN Africa video, if you have it close by.
Thank you, Clara, and thank you, Professor Francisca, for an excellent tour around the horizon of what data heralds in this new age and how you have really built on these challenges that became so clear during the pandemic. To give leadership from Africa, I can say that I was yesterday in a meeting with Leiden University leaders really on fair data, fair medical data, and it is acknowledged that the tooling that allows the data residency in location has been developed by Africa, and that this is really setting the agenda forward for a new internet in which data can be visited but are held in residence under sovereignty and ownership of the regulations in place. You have explained it so well. Behind Professor Francisca are 60 computer scientists, data scientists all over Africa. Dr. Ibrahim is one of them. He's here among the speakers. Dr. Ibrahim, maybe you want to come on stage for a brief moment. He is the director of Data Science Nigeria. And just so proud here to show this incredible science that Africa has to offer. Professor Francisca, thank you.